So hello everyone, welcome to my new video. So today I am going to discuss with you all about eyelid. Okay, so it's a series of video where I am going to upload video on eyelid, conjunctiva, cornea, everything. Okay, so we will start from eyelid. Okay, so what is the anatomy of lid margin? So lid margin anatomy is divided into two sections: lacrimal part and ciliary part. Lacrimal part is present in the nasal side, and ciliary part is temporal to the lacrimal part. So in lacrimal part there is no eyelash or gland is present, only punta is there, and in the ciliary part it is divided into three sections. So here this is the anterior part, this is the posterior part, and this is the what to say intermarginal strip. So anterior is rounded, posterior is sharp part. Okay. Here in the anterior section there is eyelashes also present. Okay. So this is the anatomy of lid margin. What are the muscles of eyelid? So there is three muscles present in eyelid. There is orbicularis ocular muscle, molar muscle, levator, palpebral superior muscle. Okay. What is the function of each muscle of eyelid? So here in this picture you can see the person is actually closing his eyes, right? The closed eye. So orbicularis oculi muscle is responsible for closing of both eyelid. Okay. So this is the due to orbicularis oculi muscle. Now in this picture you can see this person is having open eye. So here two muscles actually working, LPS muscle and molar muscle. Okay. So this LPS muscle and molar muscle both are acting on opening or elevation of the upper eyelid. Okay. And molar muscle also work in the lower eyelid opening. Okay. So failure of this LPS or molar muscle will lead to ptosis, that is the dropping of eyelid, upper eyelid. Okay. Name the glands of eyelid. So in eyelid there is multiple glands are present. Okay. So here start from meibomian gland, then gland of Zeiss, gland of Moll, gland of Krause, and gland of Wolfram. Okay. So these are the glands of eyelid. What are the number of meibomian gland present in each eyelid? So in the upper eyelid there is 30 to 40 number meibomian gland. In the lower eyelid there is 20 to 30 meibomian glands are present. So in my last video on meibomian gland dysfunction, I also showed you all about some atrophic changes in meibomian gland due to meibomian gland dysfunction. Normally in the upper eyelid there is 30 to 40 meibomian glands are present. In the lower eyelid there is 20 to 30 meibomian glands are present. Okay. So why gray line is so important? So gray line is actually present in the intermarginal strip. So it is very important because it is the landmark for lid surgery in which lid is split. Okay. So it is indicating the position of loose fibrous tissue between the orbicularis oculi muscle and subcutaneous tissue. So that's why this gray line is very important. Now before that, what is the function of eyelid? So first function of eyelid is maintaining the precorneal tear film, so that it is maintaining a proper healthy lacrimal pump. Okay. Another is to protect us from very much bright light, all those things external foreign body. Okay. So this is the function of eyelid. What is the normal position of upper eyelid? So what is the normal position of this upper eyelid? So the normal position, normally this upper eyelid is actually covering 2 mm of the upper cornea. Okay. So and lower eyelid just touches the limbus. That is the normal position of eyelid. Okay. What is the normal height of palpebral aperture? So palpebral aperture means this opening is called as palpebral fissure height. So the height is actually should be 10 mm. This is the normal range, 10 to 11, not more than that, not less than that. Okay. Now what is chalazion? So chalazion is a non-specific inflammatory granuloma of the meibomian gland. So it is seen in tarsal plate area. Okay. So sometimes you will get confused to differentiate from chalazion, stye, all those things. So chalazion always you should see, or you will observe that this chalazion will be present in the tarsal plate over the meibomian glands. But stye and all those things will be present in the eyelid margin. Okay. So what is the treatment for this chalazion? Warm compress. You need to instruct the patient to do warm compress. Sometimes steroid antibiotic is given, or anti-inflammatory also given, or ultimately if all these procedures not work, then incision and curetrace is actually done. Okay. What is internal hordelum? So this is a supportive inflammation of the meibomian gland, and it may be due to secondary infection of the chalazion that is leading to internal hordelum. So here systemic analgesics actually given to the patient, or systemic antibiotics also given to the patient for this. Okay. Now what is entropion. Entropion is simply the inward turning of eyelid, that is called as entropion. Ectropion means outward turning of eyelid is called as ectropion. Okay, so there is different classifications are also there for entropion as well as ectropion. So I will upload a dedicated video on entropion and ectropion, but for your knowledge, entropion classified in involutional, cicatricial, spastic and congenital. Okay, so here this is entropion, and ectropion is the outward turning of eyelid. Okay, so here this ectropion also divided into several part like involutional, cicatricial, paralytic, congenital and mechanical. So I will upload dedicated video on entropion and ectropion and their types, so that it will be easy for you to understand. Okay, what is ptosis? As I already told you that ptosis is the dropping of upper eyelid, that is called as ptosis. Okay, so there is different causes of ptosis. So it is including congenital and acquired ptosis are also there, like it can be due to neurogenic or it can be due to myogenic. Mechanical causes are also there, aponeurotic causes are also there in ptosis. So I will also upload some a dedicated video on ptosis workup. Suppose that you got a patient ptosis, what are those things that you need to look at in that? How, what is the PFH, what is the MRD1, what is MRD2, what is MRD3, how to see the lid LPS function, and all those things I will discuss in the next video. Just is a brief discussion on eyelid and all its disorders. Okay, what is trichiasis? Trichiasis means misdirected eyelashes. Okay, sometimes this misdirected eyelash will touch cornea and it is leading to irritation of the patient. Okay, so at that time what we need to do is we need to plug all those eyelashes, misdirected eyelashes. Okay, that is called as trichiasis. This trichiasis means there is an extra row of eyelash is there in the posterior part, that is called as dystrichiasis. You can see an extra row of eyelash is there. Okay, in trichiasis you can see the same row of eyelash are misdirected. Some are outward directed, some are inward directed, but in dystrichiasis a dedicated extra row of eyelash is growth is there, that is called as dystrichiasis. Okay, what is madrosis means? There is no eyelash, there is loss of eyelashes is called madrosis. Okay, polyosis means here eyelash turn whitish in color, that is called as polyosis. Okay, it is mostly seen in aging or Vicade syndrome. This polyosis is seen. Now what is ankyloblepharon? It is the addition between upper and lower eyelid, that is called as ankyloblepharon. What is blepharophimosis? Blepharophimosis means narrow palpebral fissure. Xanthelasma, it's a quite subcutaneous plaque, so it is due to increased level of cholesterol in the body. That's why this xanthelasma is seen. It's not indicating any risk sign for vision loss. Okay, it's just high cholesterol will lead to this thing. What is blepharitis? So blepharitis, you all know that inflammation of the lid margin due to several reasons, like it can be due to dandruff or it can be due to infection. Okay, so depending on what the cause, we need to treat it. Thank you so much for your kind listening, and in the next video I will definitely upload my video on ptosis. Okay, thank you so much.